Namaskar, welcome again to our program LIONSPEAK. In today's episode, Professor Balram Singh continues with a sequel on managing corona and will be speaking on the solutions to tackle this crisis of COVID 19. His talk was recently aired on All India Radio's World Service. Today, here we present its second part.
Seasonal variation in infection rate is very well known, most obvious being the flu season. CDC estimates that so far in this season there have been at least 38 million flu illnesses, 390,000 hospitalizations and 23,000 deaths from flu in the United States, despite vaccine and modern medicine being available, albeit only partially effective, but that is the case for most serious viral diseases. Efforts to create drugs against related viruses, including flu, SARS, etc., have met with only partial success. Vaccines are even less successful against viruses in general. Therefore, to defer the treatment efforts until a drug is developed would be abdication of responsibilities, at least in the context of corona pandemic. Currently, available anti-RNA virus drugs are likely to be as effective as any other for the purpose. And there are success stories from India, France, China for the use of anti-Ebola drug remdesivir, anti-HIV drugs lopinavir and ritonavir in combination with chloroquine to treat COVID-19 patients successfully. Thus, these treatments are at least available on an emergency basis. And for Anthony Fauci, the director of National Institute of Allergy and Infectious Disease in the United States, and others to say that President Trump mentioning that chloroquine is an FDA-approved drug was wrong is to be disingenuous. In fact, the FDA has approved it for malaria. I have worked with botulinum neurotoxins, also known as Botox, which is only approved by FDA for about a dozen indications, but it is used for over 800 disorders and conditions. So doctors can make that decision whether or not to use a drug like chloroquine. Finally, there are many herbal diets and spices which enhance the innate immunity, which in fact protects us from several dozens of viruses, and no other drug actually can protect as much as these innate immunity enhancers, spices and herbals diets. It will be only natural to encourage people to employ them as lifestyle. A combination approach of holistic healthcare and modern medicine, as is practiced in India and China, can only be helpful. The real question is why are these steps not being taken, especially when a dire devastation stares at the humanity not seen before. More importantly, there are avenues available to ameliorate the panic, but those are not being well exploited. I believe the reason for less than adequate response is the hangover of 1918 Spanish flu pandemic, which killed about more than 20 million people. Times were different. It had followed a world war. There was suppression of information as a consequence, and at least there is some suggestion that Chinese government also employed secrecy reporting the early cases of COVID-19. Interestingly, there was a reported poisoning of aspirin during the Spanish flu because people were using aspirin as if to treat this, which in fact may be making medical care with drugs like chloroquine more difficult because people are now trying to be more careful. There is also an inertia of thoughts when one is faced with such calamities, resorting to time-tested survival instincts of the past practices. So, healthcare managers in the government and hospitals are going back by the old book. However, the world has changed dramatically in view of the explosion of information technology and tools. Those technologies can be effectively used to neutralize most of the negative conditions responsible for much of the panic in the society today. Instead of the much needed but blunt knee-jerk response of total lockdown, people would be sheltered in place, but with facilitation from the modern technology. There is no need to close down shops and stores when people are already confined to their homes. There is over $100 billion worth of delivery service in the United States alone that needs to be activated to deliver everything everyone needs sitting at home. Everything that is needed in shopping can be easily experienced from home, and that will make people more compliant with the curfew, shelter in place, and avoid gatherings completely. Thank you.
Hope you like our programs. Please do subscribe to TCN channel and do not forget to press the bell icon to get the notifications of the upcoming programs. Thanks and take care.